Good evening and welcome to another of Ormco's ongoing education webinars and for 2023. My name is Matthias Carlson and I am the product manager for Europe or Ormco. I am filling in tonight for our regular moderator, John, who couldn't make it tonight. So I hope that you didn't only join to watch John and hear John talk. Tonight it's my absolute pleasure to introduce Dr. Frost, who is giving his lecture tonight from Arizona, US. Dr. Frost is a long-time speaker. I've had the privilege to listen to him and see him many times over the years, and he is a great speaker, as you all know, on innovative orthodontics. Tonight is going to talk to you all about how to get started with the Damon Ultima system, and we are looking forward to a great experience, I'm sure. Feel free to add questions in the chat and I will collect them and we will address the questions towards the end of the lecture, so in about 1 hour and 15 minutes. So we will do that at the end of tonight's program. And without any further delay, I want to hand it over to you, Dr. Frost. The stage is yours.
Matthias, thank you so much for that warm welcome. I welcome all of you tonight to this webinar. I can't wait to share with you what I've learned about Ultima, how excited I am. I was with Dr. Damon 2 weekends ago in Las Vegas, where we shared more cases and had an opportunity to really talk about the Ultima system. It's beautiful. We love it. And without any delay, let's get started. It's such a pleasure to have an opportunity to talk to you about how it would be that you could get started using the Damon Ultima system. And I've been using the Ultima system now for quite a few years. In fact, we had a prototype over 7 years ago. And then over 3 years ago, we started with the system, and it's full-time in my practice. I use it on every case that walks through the door. And so I'm going to share with you today the tips and the tricks, how to get started using that system. I invite you to be here in a few weeks to hear Dr. Bicknell and Dr. Bovenizer. We'll be speaking on these webinars and sharing our experiences with Ultima. I am a paid speaker for Ormco and appreciate all their support and partnership in helping all of you get better. This evening will be about you and what I can share with you to help you with the system. Many of you know that I've written a book on the artist orthodontist because I believe that a beautiful smile is a work of art. And when you see yourself as an artist, your cases will take on deeper meaning. You'll have better finishes, and it really will give you a more passion for our profession. And it's with that idea that I've created these protocols to create beautiful smiles. I treatment plan, as this number 1 says, around the upper incisor and the upper lip. Number 2 would be where that upper incisor is on the smile. The other third Frost Smile protocol is to get beautiful buccal arch width and for that beautiful upright posterior arch. Number 4 of my Frost Smile protocol is creating smile arc for our patients. That's where the smile flows from the front to the back and the posterior occlusion. And the very last protocol that I'll share with you is that at the finish, we should have the right, correct, hard and soft tissue contours. Now, I'm not going to spend much time talking about these protocols, but in the cases I show with Ultima, I'll be following these 5 protocols to create those beautiful finishes. I've been around for all of these innovations, if you will, for Damon. I started in 1997. I've been lecturing for Dr. Damon and Ormco for 17 years now. But I want to share with you that this new bracket, the Ultima bracket, really is a revolution. It's revolutionized passive self-ligation, and I'm going to share with you what that means. Let me just take you back for a second where I've been for the past 23 years using passive self-ligation. Now, this is a case that came into my practice, and I used the Q system with this case. Now, if you notice on this case, this is a severely crowded case with torque problems. Look at the different torques that you see in the anterior. And this patient has a little tongue imbalance. She's 14 years old and the parents don't want to have any teeth extracted. And so for us, where we've been with passive self-ligation is we've been able to unravel crowding, create arch width, and create a beautiful smile. Now, if you look closely, we're going to do this non-extraction. And one of the keys that we've used with passive self-ligation has been using variable torque bracket selection. And so we're going to choose different torques in the anterior here for upper and lower to help us. Now, with the Q system and passive self-ligation for all of these years, I feel like I've always been playing defense. What I mean by that is that I would put a bracket on, I would wait to see what happens, and then I might have to do something else to get that tooth to move to the correct position. So I really wasn't playing offense, but more defense. And so I would put torques on teeth, hoping they would go to the certain spot, but then if they didn't, I'd have to do something else. And so what we're going to see is that in this case like this, for the past 23 years, what I've been doing is taking the anterior crowding that you see here and developing it into posterior arch width. And that's the key to treating a lot of these really crowded cases where in most hands, most orthodontists, this would be a 4 bicuspid extraction case. These are the torques that I picked with the Q bracket. Now, one of the things that we noticed with the Q bracket is that the torque was built in to the base of the bracket. And because of that, when you picked a low or a high torque bracket and put them next to each other, the slots did not line up. And that causes some issues down the road, not having the level slot lineup. So if we look at this case, I'll go through, I have CT scans and I won't go into too much detail, but this is 6 months into treatment and you notice that there is not level slot lineup. Because of the torques of the low torque here and a different torque on the front, you can see there's different vertical heights of the anterior teeth. This is something we've dealt with for 23 years with passive self-ligation. Now, pretty good alignment, but again, we didn't have the best alignment between the front 6 teeth with passive self-ligation. And so we saw as we went along, things unraveled quickly and we created these arch widths. But what happened is we got closer to finishing. This is 18 months in treatment. If you look closely at this case, I've had to bend wires to get the torque correct and to get the alignment of the teeth. Now, I could have repositioned some brackets, but I find that with the old passive self-ligation, we ended up having to bend a lot of wire to finish these cases. As you can see here, there's torque bends, there's angulation bends. Although this is beautiful, it just took us a lot in treatment to get to the finish. And many of you have said to me as I've traveled around the world, many of you said that I have trouble finishing with passive self-ligation, and this is what we saw. Now, this is 22 months of treatment. This is a beautiful finish. You notice we have this upright posterior segment. The smile flows from front to back. Really nice contours of the teeth. I have good retainers, upper and lower. We're going to do clear retainers as well. But this case took me about 8 months of detailing with the finishing wire to make this case have these torques and this final position. If you look, we have a beautiful upper arch width. The teeth are now aligned, but it took a little bit of bending arch wires to get there. And you can see we have good CT scans. So a beautiful finish, but this is where we've been for the past 23 years, where we've worked a little harder to finish our cases. And so we still see this beautiful end result, and this is a beautiful smile. So you might ask yourself the question, and it's why I asked it as well. I said, why would we create Ultima? And this is the big question on our mind is if we've had a good bracket, the Q bracket was a great bracket, the Q2 bracket, a wonderful, creating these beautiful smiles, but why would we create another bracket? And so the question I have posed, and I posed this to Dr. Damon, why did you spend 10 years? So this is the last 10 years, might even be close to 11 now. Why did you design a new passive self-ligation bracket system? And Dr. Damon's comment was he knew that there had to be a better way to control the finishes without bending so much arch wire. And he knew that the minute you started to bend a stainless steel arch wire, you increased friction and binding into the case and a lot of force at individual teeth. So it was apparent that we needed to move away from bent stainless steel arch wires for torque, tip, and rotation. And so for me, I've used stainless steel arch wires for many years because of the beautiful arch shape, the arch width, and the finishing properties. But sometimes I ask myself, at what cost to the periodontium is that if we're having to bend so much wire? So in November of 2012, at the age of 71, Dr. Damon decides to design and create a bracket system and a bracket wire system that controlled rotation, angulation, and torque. And really what it was for is so we could have these high level of outcomes without having to use so much heavy forces at the end of treatment. So today I'm going to talk to you about why we're using Ultima, how is it different, and how do we use it? If we go back to a little bit more on the why, one thing that we found with the Q system, the Q2, is that we had to have compensating behaviors to finish the cases. Now, many of us were flipping brackets upside down or placing brackets more into rotations to overcome rotation issues with passive self-ligation. Many of us were flipping brackets upside down to change the torque of a tooth. And see, these are compensating behaviors that we had to overcome with passive self-ligation, such as widening the arch wires for a broader arch width or arch form, and then bending wires for our rotation control, angulation control, and torque to get to the finish. So how is it different than, say, the Q bracket or other passive self-ligation systems? Well, what we found after doing studies is that Ultima has 99% rotation control earlier in treatment, and that is after the new 14275 wire, and after it's been in the mouth for 8 to 10 weeks. And then in finishing, we have angulation and torque control, which we haven't really had in the past. This is a patient that I've shown before where we did her smile non-extraction. But when we look at her finishes as well, there were 9 months of wire detailing, and we just want to move away from that. And this is why Dr. Damon was so passionate to create a system where we didn't have to finish with so much stainless steel wire bends. So this is where we've been. And this is why it's been so challenging for us with passive self-ligation, because you have a slot right here and you have a 1925 stainless steel wire. Now, that means that our torque play until this wire engages this part of the bracket slot and down here, we have 26 degrees until we hit the couple from the wire to the bracket before we start expressing torque. So this is what's been so challenging for us. Now look at how much play there is from the base of the bracket to the wire and even from the door to the wire. There's all this play in here, which made controlling the in and out more difficult. It made rotation control more difficult and torque control. And then we had to start bending arch wires to overcome those issues. Now, I'm not saying that's bad, but it's just where we've been. So the new Ultima system was designed really around, Dr. Damon designed it around this round rectangular wire. He thought, if we're going to get rotation control and we're going to get angulation and torque control, we had to have a new wire that would actually be designed with a new bracket slot to give us that 3-dimension control. One of the great things about this new system also, which we'll touch base on, is that we have a new repositionable hook, a crimpable hook that can be repositioned during treatment. This is a big deal for us because we've spent all this time where we've had hooks that have come loose when we bend them on stainless steel arch wires, and now this is going to be a game changer. The new Ultima system really is the wire sequences and wires are virtually the same, except for the wires that are rectangular are just different dimensions. So we're still starting our cases in 014, 016, and we will also progress to an 018. Now you'll notice that the new rectangular wires are 14 by 275, 16 by 275, and 18 275, with the full size wire in the Ultima being the 18275. Now, one of the things that Dr. Damon has created is, we'll talk more about this, but overdrive wires, such as a 19275, let me go back, 20 and 21. We'll talk more about this, but every time we would go up one size, we're going to get 3 degrees more torque expression in that case. So I alluded to this earlier, that the Q2 bracket system had torque in the base. The Ultima system has torque in the slot, with a new slot with a procline and retro slot that gives us level slot lineup. We don't see vertically dancing of brackets anymore, which is really amazing. So when we start talking about where we go from here, let's go to the wire and look at some of the most important aspects of the system, and that's this new revolutionary shape wire. So the full size wire is the 18275, but you notice that it's rounded on the corner here and in the back. So we now have point contact at the door and at the base of the bracket. Now, there are other points here as well that also give us control in angulation and torque. This is what's so amazing about it. And the wire will always line up in the center slot of the bracket. We'll talk more about that as well. So this is actually a 14275, and let's pretend this is the door right here, and this is the back base of the bracket. Well, this wire is going to always be centered in the slot, but wherever this wire starts to turn, it's still going to have point contact at the door and point contact at the base of the bracket. That means we have rotation control at all times. Now, this is kind of a history of where we've been. We've been with this rectangular wire for all these years, but this is now the heart and soul of the new system, this round rectangular wire. And what's exciting about that is we're seeing big changes with our finished cases. Now, these are the brackets that have the new torques. If you notice, these brackets all are shaped the same, look the same, they have the same inclinations, because the torque is not in the base, the torque is in the slot. You can see this is a procline torque and this is a retro. We have new nomenclature that we're using to describe these brackets. But look at the brackets when you look at them from the front. They are all shaped the same. They look the same. It's easier to place the brackets. Now, we have this new parallelogram slot in the actual bracket slot. And this allows us to have a couple with this wire, which then allows us to either have a procline or a retrocline effect on the tooth. So what we're saying then is that we have this 99% rotation control, but when we finish, we have full 3D control. I'm going to say it this way. The Damon Ultima system has simplified and revolutionized passive self-ligation by reducing finishing frustrations and decreasing treatment times and numbers of visits. Okay, it's not all about the number of visits, but if we have more time to finish our cases, that means we can reposition better. And now we can play offense. We can be very deliberate on how we score by how we set our cases up. And we'll talk more about that. If I were to give you a little nuggets of what the essentials are of the Ultima system, this is how you can be successful with the Ultima system. I first want you to say, think differently than the past. And if many of you on the call are using passive self-ligation right now, you need to approach Ultima differently. We're going to think offense, not defense. We're going to think put the right torque of the bracket on the tooth and then let the Ultima system get that tooth to that delivered end position. Whereas in the past, we would just hope that it would get to that position. I'm going to tell you, I want you to use procline and retrocline brackets on upper and lower 3-3. You'll notice in some of our cases that I'll show, we started with neutral torque. Remember, I said think differently than the past. With the Q2 system, I would choose neutral torque. If I wasn't sure if we should pick procline or retro, I would just pick neutral. Well, if we pick neutral torque with Ultima, we won't get 3-dimension control. We'll only have rotation and in and out control. So I'm going to encourage you to pick procline and retro, and I'll show you how we set these cases up. Remember, the full-size wire is the 18275. That's what's going to give us 3D control. Now, if we need more torque expression in the anterior of our case, we're going to use an overdrive wire. We'll talk more about that. Reposition brackets before going into our finishing wire. So we no longer have to spend as much time on our finishing wire, so we can reposition brackets before we have to go into our finishing. Now, Ultima will give us a broader arch form, so we don't have to spend as much time in those heavy stainless steel wires. Now, let's go to the essentials and let's talk about these points. We're going to choose procline, which is that bracket that's going to procline a tooth forward into the right spot, or a retrocline, which will upright a tooth. We're going to choose those for upper and lower 3 to 3. Notice I have a big X through the neutral torque because neutral torque doesn't have 3D control. Neutral torque only has point contact at the door, point contact at the base for rotation control. But we want 3-dimension control to help us in our finishing. Now, choosing procline and retro now gives us these point contacts that help us to have angulation control and torque control. Now, these are two brackets that are put right over the top of each other. It's as if you have a procline on one central and a retro on another. But you can see that we have point contact to help us have that angulation and torque control to get us to that end position. So what we're seeing now, by choosing pro and retro on every anterior tooth, we now are seeing some beautiful control in finishing. Now, if we don't get all the torque expression that we want, we can use these overdrive wires, okay? The overdrive wires will express more torque. And you can see right here that we'll get 3 degrees more torque expression for each wire size that you go up. So if you go to a 19275, that's 1/1000th higher of a wire. That's going to give us 3 degrees of torque of whatever prescription we have on the tooth. If we want more than that, we can go to a 20/275. Now, I want to make sure we all understand that the overdrive wires, and I think I say this in a minute, but the overdrive wires for Europe with TMA and copper nitride will be coming out in around August. Okay, so 2023, you'll be able to have copper nitride and TMA wires for overdrive in August. Okay, now once we talk about this, let's say that we picked the wrong torque in the beginning, whether it was pro or retro, now we're going to reposition the brackets before we ever get to the stainless steel or the TMA finishing. And in some cases, we're going to finish without even having to put a finishing wire in. We can finish in copper nitride, which is really, we realize that is now a reality. Whereas before, I don't think I ever finished a case with just copper nitride. So this is a friend of mine from Texas. He said, I'm seeing lots of Ultima cases at their 6 to 8 month appointments, and they look amazing. Cases are under control. Arch width is arch width. They just are a different beast. They have pop, which we've been missing. That was from Dr. Harwell, a friend of mine. So when we start talking about Ultima, I want you to understand that we need to understand how to place the brackets for Ultima because it's a little different than Q2. The Ultima and Q2 brackets are not positioned on the tooth the same way. The Q2 is a rhomboid shaped bracket and the Ultima is different. So upper 3 to 3 are slightly offset on the Ultima pad. Let's take a look at this, okay? So this is the bracket design. We've talked about the level slot lineup and how the brackets look the same. And this really aids in positioning these brackets to the right position. So if we look back at Q2 for just a second, that's a rhomboid shape pad, and the bracket is actually parallel to the pad. So interestingly enough, the Q2 had different shape of a bracket on the centrals, the laterals, and the canines. So we're gonna look at this differently here. Q2 were positioned according to the long axis of the tooth, and the doors on the Q2 had scribe lines. So this is how we would position the Q2. Now this is different than what we have now. And so I'm going to show you that here in 1 second. This is a case that I had Q2 on, and you can see that because there's an angulation here, sometimes this was hard to line up. So they had created on the Q2 a little long axis scribe line on the door that matched the long axis of the pad as well. And so this is how we were lining things up. And sometimes we still had trouble lining those up. Now, let's talk about Ultima for a second. Let's understand that the Ultima bracket is positioned on a Q2 pad. So we didn't make new pads. We just have a different bracket that's using the Q2 pad. So this is the Ultima pad. This is the Q2 bracket. You notice they're parallel and they look the same. The bracket's parallel to the pad here. But when we start talking about the Ultima bracket's a little different. Now, let's say this is the pad for the Q2, and that would be lined up with the long axis. But we're not going to look at that to line up the Ultima because the bracket is offset on the pad. Now, Dr. Damon did this because he felt like we would use the slots to help line the Ultima bracket up. So we're going to use the slot of the Ultima bracket to this incisal line of the tooth. So the incisal edge to the slot. Now, we can also use the mesial of the bracket to the mesial line angle. That would be number 2, but this is how we're going to position the brackets. Okay. Notice the Q2s differently. That whole bracket's positioned differently. So we're not going to be doing that. We're lining up the slot to the incisal edge. So when we start looking at the differences here, Ultima is on the right. We're using the incisal edge to the slot. That's how we're going to line these up. Now, if you look, we're still going to place the laterals just a little bit mesial to that long axis. Nothing's changed with my bonding, the way I position the brackets mesial and distal on the tooth. The laterals are still slightly mesial. The cuspids are slightly mesial as well. Okay. This is a case that I finished without repositions. Notice that this is the Ultima bracket. So I'm going to line up the slot to the incisal edge. Here's the slot to the incisal edge. And this is going to play out very well. This is a case I finished that's beautiful without having to reposition any brackets because I understood how to position the brackets on that tooth. Here's her finished result. Beautiful upright posterior arch and a beautiful case. So there's one other aspect that I want you to be aware of that's so important, and it's really impacting my practice for the good. It's these new Ultima hooks. These Ultima hooks can be used instead of wire tie on the upper and lower 3-3. I'm going to show you what that means. These hooks could be called like gorilla hooks. They can't move unless you release the hook on the wire. The great thing is they're repositionable. So you can actually put a hook where you want it, and the next visit, come back, you can move that hook to a different spot, and they're not going to come off. These hooks will come in 14 by 275 copper nitrile and 18 275 copper nitrile, but they can be moved during treatment if you need to. Now, you'll have these hooks available in August along with those overdrive copper nitiles. So I'm going to show you how we use them so you can be aware of it. Now, here's the hooks. This is a beautiful hook. It's a copper nitrile hook, and you can see how it can be put right up against the bracket of the 3. This is the plier that we'll use. You notice that it has a little tweezer on top to go underneath the hook, and another part that comes down to release that there. Now, these are beautiful. We have them in our practice. We're using them. It makes it really nice because when we transition to that rectangular wire, the 14 by 275 round rectangular wire, we used to figure 8 lace everything so no space would open up. Now, what we're doing now, instead of doing the figure 8 lace, we're putting this hook on the 14 275 cinched up against that 3 bracket, the cuspid bracket, and that's allowing us to not put wire tie on there and to keep the space consolidated. Now, if we want to, on the 14 275, we can run power chain, and we're going to talk about that in a second. But these hooks are easy to move and put up against the 3 bracket. So very nice. Now, we also have these hooks, so we can use hooks for closing springs. So if we're closing space, we can run off of the molar forward to this hook. We can wear elastics off of this as well. So we can also do our little lace back. Now this is a tie back, which we've used with the Damon system for 23 years. I have anyways, where we would, to keep space closed, we would put a little tie back module from the hook of the 6 up to this hook on the wire. Now in the past, we put this hook between the 2s and the 3s, but today, because they're movable, we can move them either in front of or behind the cuspids. This is a patient that we used the Ultima hooks on. As you can see, this is our beginning wire. She's got to notice the torque on the case. Looks very nice. We're using proclining torque, upper and lower. Now, 2 months in, we're placing our 14275, but see the hook? It's positioned right next to the 3. This is a little video that just shows us positioning it.
Oh, are you placing the hook thingies?
Notice that my assistant said, are we placing the hook thingy? That's not the term we use, but this is an Ultima hook. Now notice that hook is actually angled in towards the tissue. So we're going to just go in and change that inclination of the hook. So you go in, you release the hook, and then you can position that in a better spot. Okay? And that's going to stay right where it's at. The lower is the same. We're going to release it, release the hook, slide it forward to the cuspid. And that's how we place these on there. Now, let me just show you a case that we're going to do treatment on. This is a young fellow. We have proclining torque on the upper. We're in our round wire to begin with for 10 weeks. Now, when he comes back, we're going to place the 14275 in. And because we have rotation control at the 14275, we're consolidating spaces in the beginning at that second wire or third wire, the 14275. In the past, if we put a 1425 with power chain, we would see rotation problems all over the place. Because of that new round rectangular wire, the 14275, we're able to control rotation and we can consolidate space in the anterior. Now, once it's consolidated, here's an 18275 wire, but notice we've put the hook right up against the distal of that 3 bracket and on the other side so that we don't have to have any power chain or wire ties on the front. And the patients can brush better and take care of their teeth. Now, let's be clear about something. These Ultima hooks can also be used to close space. So if we're wanting to do elastics, we can use them for elastics. But this would be a setup, say that like we have maximum anchorage, where the wire, the finishing wire goes all the way back through the 7. And if we wanted to bring anteriors back, let's say if it was an extraction case, we would take the hook, the closing spring off the hook forward to the new Ultima hook, and that would allow us to retract the anterior. Same on the lower. Let's say that we were extracting the 4s and pulling these back. So we're using the Ultima hooks for space closure. Now let's say that we want minimum anchorage. What we would do, let's say that we want to slide molars forward to close space. Now we clip the wire distal to the 6, put the closing spring off of the back of the 6 wire. See that wire coming out the back of the 6 and up to the hook, the Ultima hook. And then we have minimum anchorage. We'll slide molars forward. It's the same on the lower. We cut the wire distal, run the spring off the back of the wire coming out of the 6 forward to the Ultima hook. So if we look at another case, this is a case where we've picked proclining torque. Notice they're proclining torque upper 3 to 3, lower 3 to 3. And one thing that we're noticing in our cases today is that any cases that are like narrow arches and slightly upright, we're noticing that the more arch width we get, the teeth tend to dump a little bit. So we're seeing more uprighting of those posterior segments. So we're choosing proclining torque more often in our cases. This is this Shelby, one of my assistants. You can see that we're in a rectangular round wire, 14275. There's the hook, same on the lower, and the hook on the top. She comes back in. We're going to reposition some brackets. We can move the hook if we want. Now, I won't get into this because my colleagues will get into this in the few weeks, but there really is 3 active parts to treatment. Phase 1 is the very round wire stage with 013, 014, 018, and then the transition to the first round rectangular wire. There's no need to rush this phase. Now we want to spend our normal 10 to 12 weeks in that first initial 013 or 014. We'll spend 6 weeks in the 018 going 7 to 7. That's going to prep the case for the 14275, which then comes in. We leave that 14275 in for a good 8 weeks. And then phase 2 is when we transition to the full control in 3D, torque control. And if we need to, we can reposition brackets. The last phase is just our finishing phase where we have either stainless steel, TMA, and there are some cases where we may not even get into phase 3 because the positioning was good and we don't need the arch width. So these are the 3 active phases. Now what we're going to do is we're going to start looking at some cases here for the rest of the time. And I'd love to just go through those things and point out the basics of the system so we can see this. This first case is a full class 2 case. Now, this case, I presented to the mother that her daughter is very gummy in her smile. And she has, if you look at her x-ray, she has a skeletal class 2. And so what I did on this case is I said to the mother that I like to use a Herbst appliance to bring the lower jaw forward and balance the facial features out. In this case, I would use 4 TADs for her gummy smile to correct her gummy smile. So this would be a Herbst appliance to fix and bring the lower jaw forward, 4 TADs to raise the gum tissue, and the mother said, we're not interested in that. So if you look at her, she's full class 2, and she's a little bit crowded, not much crowding at all. Notice the upper 2s are slightly out, they're flared. So when we start to go and start to talk about what we're going to do for torques, this plays into our choosing of our torques. Now notice how narrow she is. Posterior arch is dumped in, and again, they have denied class 2 correction with a Herbst and denied the gummy smile. So this is just going to be Ultima brackets with elastics, class 2 elastics to correct this case. Now, whenever I see a lateral that's up higher and flared, I know when I put the bracket on and bring this tooth down to match the others, that the tooth will probably dump a little bit. So I'm going to choose proclining torque upper 3 to 3. Now we'll go through this case pretty quickly. You can see this is 2.5 months. We've just transitioned to the 14275. Notice that she has wire tie under this wire. We did not have the Ultima hooks at this time. Today, I'd like to put hooks on at this point with no wire tie. So if you have Ultima hooks, we would put those on instead of having to figure 8 lace that. Now notice we've not started any class 2 elastics. I don't want anything to inhibit the arch development of this case, so we're going to wait on starting elastics. See what's happened here as the 2s have come down? They're going to match beautifully now by choosing proclining torque all the way across the top. Again, we're 7 to 7 with our 14275. Now, this is 4 months into treatment, and I'm going to do a panel reposition visit and reposition a few. And then I'm going to, we're going to put in at that time, because we didn't reposition that many, I'm going to go ahead and go straight to the 18275 and start my elastics. Now, the point is, I don't want to start class 2 elastics until I have arch width developed and I'm in the full control wire, which is the 18275. So we're going to start class 2 elastics. It's going to go from the 6 up, and we're going to put a hook between the 2 and the 3 for our class 2 elastics. Okay. So at 6 months into treatment, I've been in the 18275 for 6 to 8 weeks. But in this case, I felt like that I'm going to choose a finishing wire to give me more expression of anterior torque. So I'm going to choose a 19275 stainless steel, and I'm going to use that to widen the wire a little bit. If you look, you can see that the posterior teeth are still dumped in slightly. Okay, so I'm going to widen that stainless steel slightly, but I also want more proclining torque upper 3 to 3. Notice in the lower, I'm putting a 16 by 275, and then we're going to keep going with our class 2 elastics. So now we're in class 2 elastics from lower 6 to upper post. These gray things here, this is the tieback module I was talking about earlier. That's just to keep the space consolidated in the posterior. Once you've closed space, we keep it consolidated that way. Now remember what torques we have. We chose a 19,275 to express a little bit more torque. But look how beautiful this is. 6 months into treatment, look how this is lining up. This is what we're seeing in our practice, just beautiful alignment. If you look at our 8 months, we're starting to see more torque in the posterior and on the cuspids, and more expression because we're in overdrive wire. She's still using class 2 elastics, but look how pretty this is. Look at the arch shape, beautiful arch shape. Here she is at 8 months. Now at 8 months, I still need a little bit of uprighting of both the lower and the upper segments. So I'm just going to widen the stainless steel slightly to upright those posterior arches, and we're going to continue with our elastics. Okay, you can see how beautiful this is. Now, one thing I am noticing is that the correction with the class 2 is happening a little earlier. Look how pretty this is starting to upright in the posterior. We're going to do a little bit of interproximal reduction on this wire. So we're doing a little bit of IPR on the lower. And we're going to keep going with our class 2 elastics. Here she is at 10 months of treatment. And it's amazing to me to see. Now, we just need some settling elastics on the back and keep where we're at right here with our class 2s. This looks beautiful. I'm noticing a different experience here with Ultima. Now, I'm not saying every case is going to treat out this fast. It's just interesting to see my first class 2 case with elastics in Ultima, and it's really looking beautiful. That's 12 months of treatment. Now, she finished at 14 months. Normally, with my class 2 cases and elastics, I'm 18 to 20 months of treatment time. But, mother, and sometimes in the United States, the parents would rather them finish earlier than go longer. So I want you just to take a look at how beautiful this is. Now, again, I know she's gummy, but she chose not to do gummy smile treatment. But really, for just class 2 elastics, that's a beautiful facial result. If you look at how pretty this is, how it flows from front to back, very nice. Good incisor display. This is immediately after we took the braces off. We're going to retain this with a Damon splint, which is 2 clear retainers luted together to keep the jaw forward so we don't have any movement back. And if I was concerned about this, I would many times we'll just stay in the elastics in treatment for another 2 or 3 months. But mom was adamant to take these off, so I would be okay if we stayed in treatment a little longer. Let's look at a different case. Let's look at a Ultima class 3 case. Now this is Logan. If you look at Logan, you can see that he's narrow, slight open bite, and he's kind of edge to edge. So in his case, we start saying, how are we going to widen and broaden the smile and upright? And this is going to be just a simple case where we put Ultima brackets on, run elastics. We're going to develop the upper arch. And you can see it as initial bonding. Now, I want you to look. This was about 3 years ago when I started this case. Notice he had neutral torque in the front. Today, I would be looking at proclining torque, upper, lower, 3 to 3. He had neutral, which we ended up having to swap out brackets along the way to get finished. So today, I want you to be aware that we don't use neutral torque. We're using either procline or retrocline. Here he is at his first visit back. We're putting 018 copper nitai. At the next visit back, we're going to place 14,275s. Again, notice we don't have the hooks. We didn't get those until recent. Here he is at 5 months into treatment, and we're placed the 18,275 top and bottom. Now, we're not going to consolidate space quite yet because I have nowhere to close that upper space. Notice he's just edge to edge with his bite. So we have to wait to get some overjet before we close that upper space. So we're just doing some elastics and working on the arch width. This is at 5.5 months. Now at 7 months, we're now going to start to power chain, because we're going to see that with our elastics, we're going to get better class 3 control, and we're going to start power chaining and closing space. At 10 months, we're going to reposition the upper 5 to 5. Now we're going to want to get in a proclining torque to help those come out. You see how upright these are? If we would have had proclining torque to begin with, then we would see this case in a different position now. So we're going to put proclining torque on. We're going to drop to an 018 wire. And I usually don't like to do that where we go up to a full-size wire and come back down. But this is one where we realized we had neutral torque on, and we're just going to, we've learned from this that we choose a proclining or retro to begin with. So here he is at 11 months. This case is starting to turn out really nice. We're back up to our full-size wire. At 13 months, we're in our 19275 stainless steel. Why did I choose 19275? That's for the full expression, more torque in the anterior. And we're going to keep working on our elastics to bring our bike together. Here he is at 19 months of treatment. We're going to do some IPR between these ones, and we're checking to be done. At 20.5 months, we're finished. A beautiful ultimate case. You can see how he's widened and broadened, and has a good incisor display. So when we start talking about class 2 elastics or class 3 elastics, I start to see beautiful responses with the Ultima and beautiful arch widths as well. Let's look at one of these cases here. Now this is a blocked out canines. And this reminds me a lot of Dr. Damon's case, where he showed a case with Cody Biddle, where we had completely blocked out cuspids, and Dr. Damon used long coil springs to bypass the teeth and keep the cheeks off of the teeth. Now, what we're going to do in this case is we're going to open up the space for those blocked out cuspids. Now, if you look at her facial features, she really can't handle 4 bicuspid extraction. So we want to do everything we can to bring upper teeth forward, widen and broaden to make space. Okay, we're going to choose good torques here. Now, on cases like this, we're going to do this non-extraction. Now, we used to call this a D gainer. I call it a T gainer, T as in Tom. T gainer means we're going to increase the transverse. By doing that and widening the arches, we're going to get space for those cuspids. And we're going to use team torquing when we start talking about torques. Now, again, this was started a couple years ago. Today, I would be choosing a procline torque on the upper 1s, retro on the 2s. And notice how we've done this. Notice these coil springs. They go back from the 6 to the 2. That's to shield the cheeks off of the teeth and allow the arch width to gain arch width and let the tongue lift to the palate. Now at 10 weeks, we placed 018 copper nitrile 7-7. This is same type of stuff we've done with passive soft ligation. We've activated the coil springs, a half a bracket of coil from the 6 to the 2s. At 4 months, we've added more coil springs, upper 6 to 2s. And then on the lower, we're doing coil spring as well. And we'll show you as we place the 14275 at 5 months, we're adding more coil springs. At 7 months, I don't have pictures, unfortunately, but 18275 and increased coil springs. So 7 months in, we're still making space with coil springs for the cuspids. Now check this out. This is what's amazing. In 8 months' time, we've done very light coil springs. We've started to increase the arch width. Notice we have plenty of space for the cuspids. So we've bonded the cuspids and placed 014 copper nitrile. Look at the lower, same thing. Look at the space we have now just by working on the transverse and keeping the cheeks off of the teeth. Now, this is going to be a beautiful case. This is 10 months of treatment time. And we've now placed 018 copper nitrile 7-7 upper and lower. At 11 months in treatment, we placed 14275 and the lower as well. Now, 13 months, we're going to do a little reposition visit because we didn't do our reposition up until this point. So now we're going to reposition some of the teeth and move this forward. Now look how pretty this is. Fully blocked out cuspids. We have the cuspids in place. Now we're just going to detail. We're going to reposition brackets, put the right torques on, and finish up. So you can see where we were. We're going to change these out to proclining, and you'll see how this looks. Now, after 13 months of treatment, look how pretty this is lining up. And here's 15 months of treatment. We're in our finishing wires. The twos look like they're still needing a little bit of torque expression. So those are going to get repositioned. So we repositioned the upper twos to bring those down and put the copper nitai in. Again, we're only 16 months into treatment, and to reposition is not a problem at this point because we already have the transverse. That's what I'm seeing with Ultima, a beautiful transverse development. And now we don't have to spend as much time on our finishing. So here she is at 18 months, we reposition the twos, and it's beautiful. Let me show you one more of these types of cases. Now, this is a class 3. It's a little different than the last one. The last one, we used long coil springs to increase the transverse. And so we did things a little different. Now, this one is class 3 with blocked out cuspids, but if you look at her facial features here, this patient is mid-face deficient. So a little bit different type of facial structure, mid-face deficient. Notice the lower incisors are tipped back. This is a really difficult case. When we start talking about how are we going to treat this case, in this situation, I start thinking, how do I get upper incisors to move forward? Now, let me draw your attention back to the very beginning slides where I talked about the Frost Smile protocol. The Frost Smile protocol, number one thing is we want to treat to the upper lip and the mid-face. So in her case, I'm thinking, how do I get more mid-face support and try to balance out her facial profile? Now, of course, this is a case that I certainly wouldn't extract on, and we're going to treat this without extractions and without surgery. So what I want to do is I start thinking, how do I get the upper incisors forward? And then what torques can I use to get the lower incisors upright? And we're going to do elastics to help us. Now I see a blocked out cuspid here, so we're going to use coil springs. So let's take a look at this. Notice that the arches are dumped in. Look how narrow the lower arch is. I'm going to spend time widening and uprighting and have all of these teeth fit beautifully. Okay, you can see her profile. And my treatment plan is to do this non-extraction for mid-face support. We want more upper lip support. We're going to bond the brackets to enhance the smile arc, and we're going to start with 0 and 4. Okay, we're going to choose retrocline brackets because, as in this case, I'm going to engage everything. Now, this might go against everything that you've been taught, but for me, I want upper incisors to come forward, but I want to do it slowly and do it to where we don't just flare the incisors forward. Okay, I want procline lower 3 to 3, so those will upright. So here's my torque. I know that as the cuspids come down, they're going to dump. So I'm picking a procline torque on the 3s. And I know that the incisors are going to want to flare because I've engaged everything. I purposely have set this case up to have upper incisors come forward for the facial features and lower incisors to come forward as well. So 014 copper nitai engaging everything. The only thing we're not doing is putting coil spring for this blocked out 5 yet until we get to a bigger wire where the wire won't just pop out. Okay, so we're going to open up space eventually for this lower 5. Now at 10 weeks, we're going to come back and we're going to place 0 and 8. Check this out. It's interesting to me. I don't see any flaring. The upper lip has kept the upper incisors from just flaring forward because I used a light round wire. Notice now with the 0 and 8, I'm going to put coil spring for the lower 5. And you can see how it's interesting to me. The upper incisors are not just flared forward, but look at the arch development in just 10 weeks. Now, we might say to ourselves, why does this look so good at 10 weeks? Well, that's the tongue going to a better position that's going to help us with this case. Look at the lower. Here she is at 4 months. We've just placed 14,275. Okay, and again, remember, I've not done any elastics yet either because we're waiting for the 14,275 to get expressed before we start any kind of class 3 elastics or even anterior elastics. Look at 4 months into treatment, how pretty this is looking. The arch width looks amazing. We're just placing the round rectangular wire. We're not even in the round rectangular wire yet. So up until this point, this has been round wire. The tongue has been helping us upright these teeth. Now we've just placed the 14,275. Let's see what she looks like at 5.5 months. 5.5 months, you can see how pretty this is looking. I'm going to reposition some of the brackets. Okay, notice I'm still making space down here with an 018 wire, and then we're going to bond that now that we have space. Okay, so at 6.5 months when she comes back, notice that this has been bonded, and we're putting a 14,275 in the lower and 18,275 on the top. Now I'm going to start my class 3 elastics because I've given the system the opportunity to, nothing's interfered with that transverse arch development. Now I can start my class 3s and not have my elastics negatively impact the transverse arch development here. Okay, so now that we're 7.5 months into treatment, I'm putting steels in. Now, one of my old thought processes was this. On a case like this, if I was in the Q2 bracket, I would have known that when I run class 3 elastics, the upper incisors are going to flare forward, the lower incisors are going to dump. Excuse me, the other way around. Sorry. The upper incisors are going to flare forward, and from the class 3, the lower incisors are going to dump back. So I had chosen low torque or retro torque, thinking that the upper incisors may come forward. Well, with Ultima, we don't see that. We don't see teeth over proclining or over uprighting. So in this case, I'm going to have to switch the torques, completely opposite of what I would have thought back when I was using the Q2. Now, when I run the class 3 elastics, I'm not going to see the upper incisors over procline because I know that the full size wire controls that with Ultima. So we chose proclining torque. We're going to keep going with our elastics. Look at the response we're getting here in 12 months. Now this is looking beautiful at 12 months of treatment. When you look at this case now, there's a bracket position error here. There's a bracket position error here. In fact, one of the other doctors in our practice was trying to make a bend here, but this is where we should just reposition. So reposition that bracket, reposition this one. And where do we go from here? Notice that the posterior arch, look at the 4s. Do you see how it's still dumped in slightly? Look at the lower arch, it's still dumped in slightly. So where we go from here is we're going to widen and broaden the wire slightly to upright those posterior segments. Do you see how that's still dumped in a little bit? So we're going to widen the wires and keep working. But this case is amazing in just 12 months of time. And now I get good 6 months to keep working with this and getting the right torques and getting the right positions. But look at her facial features. I deliberately chose this case to procline those upper teeth and bring them forward for her facial features. And it looks beautiful. Now, let's look at another case. This case is an Ultima class 3 open bite with tongue thrust. This is Andrea. She is posterior gummy, meaning she's showing a lot of gum tissue in the back. You can see she's open bite and has a tongue thrust, slight class 3. This is a tough case. We're going to use Ultima brackets to treat this case. Now, whenever I see spaces like this, I know I'm going to close spaces back. So I'm going to start thinking proclining torque, upper 3 to 3, proclining lower, because I don't want incisors to dump. I want to keep them upright. So notice we're going to control the tongue and get the tongue off of the front teeth. So the tongue is causing all the space. So we're going to put lower 3 to 3 tongue reminders on this case, which we're going to control. the tongue and have the tongue lift where it should go. Now notice I'm choosing proclining torque, upper and lower 3 to 3. And we're going to use good wire sequencing. So we started with 014 for 10 weeks. We did 018 for 6 weeks. And now we've just placed the 14275 upper and lower. Okay, no elastic started at this point. Okay, now at 4 months, when she comes back after the 14275, we're going to reposition. So we're going to reposition any brackets, and we repoed the upper 2 to 2. And one thing I find is that when you reposition earlier on the 14275, I was able to place the 18275 without any problem because of the rotation control and the uprighting. Notice how pretty this is. We're controlling the tongue, but notice at 4 months, she's still pressing with her tongue right here. Can you see that? And that becomes a problem. If this wire is going to straighten out, we have to get the tongue out of the way. Now, we've done some IPR at 7 months of treatment. Why did I pick 19275 stainless steel in the upper? Remember, the full-size wire is 18275, but I've purposely picked up and one more wire increase to express a little bit more torque in the anterior upper 2 to 2, 3 to 3 really. So notice that we repositioned at 9 months. The upper ones didn't look right, so one of the doctors repositioned. At 10 months, we're back into our steel, and this is looking beautiful. Look how pretty this is. And controlling the tongue and having good torque gives us these beautiful end results. Here she is at 14 months. We're just settling the occlusion in the back, and 15 months of total treatment time to treat this case. I want you to look how beautiful the posterior segment is. Notice that when we widened and broadened with Ultima, we decreased the gum show. Isn't that pretty? This again, good contours of the enamel and of the gingiva. A really pretty result. This is what we're seeing. Great torque control. Look at the front with the great torque control. And this is a beautiful case. So good retention afterwards, knowing we had space to begin with. We're going to use a permanent wire up there. That's going to lay flat against the incisors. This is a braided flat wire. On the lower, this is a stainless steel 026, just bent on the cuspids and bonded on every tooth. A really pretty 15-month case. And so this will be the last case we'll discuss tonight. This is a very straightforward case, but it just shows the power of Ultima. If you look at her case, she's canted up slightly on the right side. Many times when patients are canted, either up on one side or down on the other, we'll use TADs to correct these cases. If you look at her, she's class 2 on the right, midline is off. She's canted up from a tongue. And one of the clues that I see when I look at this case, I can see the tongue pushing right there. That usually tells me that there is a tongue imbalance, and I have to be aware of that as we treat this. So she's class 2 right. And we're going to use good torque control. Now, one of the terms that you're going to hear over the next few webinars is this thing called team torquing. And team torquing just means we're going to pick pro or retro on every anterior tooth. And that's what we're going to do here. We call it team torquing. And we're going to do class 2 elastics, but we're not going to do the elastics until after the 14275 has been in and given us the most arch development that we can get. So this is what we chose. Now this is retrocline torque. The teeth are flared slightly, so I put retrocline torque upper 2 to 2. The cuspids are angled in, so those are going to get proclining torque. And I know that the lowers are out a little bit, so we did retrocline torque lower 2 to 2, procline lower 3s. Okay, so we're going to put a little bite turbo on the 6s right here to disarticulate, and then we're going to let this work. So this is the initial wires, 014 copper nitai. Now these are the wire sequencing, 014 copper nitai for 10 weeks, 018 copper nitai for 6 weeks, and then we've placed the 14275 for 8 weeks. Now the patient comes back, we're 6 months into treatment, and we're repositioning brackets, okay? So we're going to reposition brackets. You can see where she's come from. Look at this. Look at the arch shape difference from side to side. This is just 6 months. This is what's so powerful that I'm seeing with Ultima, that change in the anterior, the change in the transverse arch, and we're just seeing these beautiful cases. This is 6 months in. We're going to reposition a couple brackets. Now we're going to reposition this 3 and upper 2s. Now, remember, we chose retro torque in the beginning, but if you look, these 2s are slightly upright. So knowing that they're probably not going to upright to the fullest in the 18275, we're going to change those out to procline torque. Okay, so we're going to reposition, and then we're going to put the 18275 in top and bottom, and then she'll come back. So here she is. Okay, we're going to change the torques out on these 2s and to procline torque. Now remember, the uppers are retrocline torque. The 2s now are procline. The 18275 has been in for 1 visit, and you can see that they still maybe need a little bit more expression. Okay, so we're going to start our class 2 elastics on the right. Again, we're in that big full-size wire, and we're going to correct the class 2. Okay, on the other side, we're going to just do a V elastic, which is an upper 6 below the 4 and up to the post. So at 8 months, look at the arch width. It's beautiful. We're now in our stainless steel on the top and 16275 stainless steel on the bottom. Okay, now at 9 months into treatment, there was a decision made to choose a procline on the ones so that they would all be procline across the front. So now we've repositioned for proclining torque upper 3 to 3. And we're getting closer to being done. Now, interesting, she's only 11 months into treatment. We're doing a V elastic on the left, which is just upper 6 below the 4 and up to the post. This is a settling elastic, vertical elastic. And we're still doing a little bit of class 2 on this other side. Now, this is about the time we're going to take the turbos off and make sure the occlusion is just right. And here she is at 13 months of treatment, really beautifully treated. So when we start looking at these cases, look at what Ultima does. Ultima creates that beautiful wide arch, beautiful smile. You can see we've done a little gingivectomy here to enhance this. We have beautiful occlusion on the right. Look at the arch width that we have. Very pretty. Good retention. You can just see how we're 13 months to our final. So if you're ready to take your practice now, Matthias, we're going to open this up for questions, but if you're ready to take your practice to a new level by working smarter and being more efficient, Ultima is for you. I'd have you contact your dealer and your Ormco representatives. What we'd like to do now is open this up for questions and have an opportunity to clear anything up that maybe we need to at this time.
Thank you so much, Dr. Frost. We have actually quite a few questions, so let's see how many we can go through. And if questions that are left unanswered, you will be sent an email, all of you on this webinar, that you can send these questions in, and we will get them processed over time. But starting with one question here about the bicuspids. If you have so the question is, for first bicuspid, we used to have high torque brackets in the Q2 system. How would you correct the problem of excessive lingual inclined torque of first cuspids?
Really great question. Now, let's go back for just a second. What I'm seeing with Ultima in the 14275, because it has point contact at the door and the base, we're seeing a better uprighting expression on upper arches and lower arches. So we don't need a high torque lower bicuspid bracket anymore. Just that standard torque is plenty upright. Now, let's say this. If we don't see it upright enough, like I pointed out in a couple of cases where we still saw some lingually inclined bicuspids or molars, then we're going to slowly use our stainless steel to bump and upright the posterior segment, upper and lower. So we use a steel wire to help us upright those lower bis if needed.
Perfect. Thank you so much. Next question here. Dr. Frost, using the combination of pro and retro resulting in various contact points, is Ultima still PSL?
Yes. The beautiful part about Ultima is that even though we will have a point contact, we don't, I guess I could say it this way, because there's point contact on the full size wire, we don't get the friction and binding, say like a active clip that actually the clip shuts and touches the whole wire and seats the wire to the base. We don't have that. So we're still passive self-ligation, but in the full size wire, we have point contact where needed to express torque and uprighting.
Thank you so much. A couple of questions here on the torque selection. So the question is, for canine brackets torque selection with DQ2, we used to use standard torque if the initial torque was good, or high if further torque was needed. For Ultima, what torque should we use? Thanks.
Yeah, this is a really good question. And again, what I'm experiencing in my practice, I'm using Procline torque on probably 70% of my upper canines. Because think about this for a second. So we're seeing a wider, broader response with Ultima in the posterior. If you get a wider arch, you'll start to see anteriors dump in a little bit. It's the old principle. If you take a balloon and you pull on the sides of the balloon, the front part of the balloon flattens. So for me, because of that expression in the posterior, I'm using a little bit more proclining torque in the anterior and even on cuspids to help us keep an upright cuspid.
Thank you. And then we have like 2-3 questions on bracket placement, and they kind of go around this. So maybe if you could open that slide and just show the basic reference points again, I think we can answer 3 points in 3 questions with one stone here.
Okay, where do we want to go?
So the questions is like what basically what reference points?
Okay.
Yes.
Let's go back. Let's go to this one right here. Okay.
Yeah.
So for Ultima, we're going to use 2 reference points. The first reference point is the slot to the incisal edge. Okay. So we're going to put a line through the slot, and this line should parallel the incisal edge. That's the first reference point that I use. Now remember, the bracket is offset on the pad. So we can't use the pad to line up. You know, we could if we could see it, but we have to position this differently than Q2. So what I've done, and if there's somebody out there that has used the D2 bracket, which was back in the year 2000, this bracket is set up the exact same way as the D2 bracket, where it's slightly offset on the pad. So the way we positioned this, 20 years ago was we used, everybody can see the slot because the slot is so big. So you're going to use the slot to what the incisal edge is. And then the second reference point, if you need another one, I rarely use this second reference point, but you can imagine the mesial line angle to the mesial part of the bracket and make that parallel. That's your second reference point. For me, it's mostly just the slot to the incisal edge. Now, somebody might say, well, what if the incisal edge is worn? Well, all of us are dentists before we're orthodontists. So we can see an incisal edge. If you need to, you can build up the incisal edge with composite, or you can manicure that incisal edge to see what that tooth should be. So where that bracket should go. So the incisal edge is money for me. It's what I use to position these brackets.
Thank you. Perfect. So I think we answered 3 questions in one answer. That's perfect. So this is an interesting one. Based on your experience with Ultima, how many cases, the percentage, would you say could be finished with copper night tie?
So this is such a personal decision, because when you listen in 2 weeks to Dr. Mike Bicknell, he's going to show you that his goal in treatment is to finish all of his cases in copper nitride. And that's not wrong. But for me, I feel like that what I'm doing with treatment needs a stainless steel wire. Like if I'm doing TAD intrusion or heavy class 2 mechanics in class 3, I'm going to be in stainless steel wire to do that. So I also am really paying attention. I've made a study over the last 23 years of arch width, because I understand that if you get the transverse, meaning if you get the beautiful upright lower arch, upright upper arch, that then that's the most beautiful occlusion. That's the most beautiful look. So for me, many times coming out of copper nitride, the torques will be right, but I don't have a beautiful functional occlusion, and the lowers might not be upright enough. So I'm always going to stainless steel to take it to a different level to get that beautiful occlusion. And if you notice the cases that I just showed you, the finished cases, they're just, the posterior arches are upright, they're beautiful, but I didn't get that from copper nitride. So if I gave you a percentage that I would finishing, it would be less than 10% of the time I'd be finishing in copper nitride. For me,
sorry.
Yeah, is that okay?
Yeah, sure. And I think that just shows us that this is you are still this is not just a bracket you can put on and will do everything. It's an art form, so we will have huge personal variances in this. Thank you so much. So another one here. If we need an extra negative torque, would you consider flipping the Procline brackets as we did with DQ2?
Yeah, so this goes back to my comment earlier in the seminar where I said, we were flipping brackets to play defense, to prevent something from happening. Well, the way that Dr. Damon has designed the bracket with the pro and retro torques and that round rectangular wire, when we use the pro and retro, it's designed to get the tooth to the end position. So it's a mathematical equation, and I'm not the best at engineering. I know what it looks like in the finish and how to get there, but the way that Dr. Damon designed that round rectangular wire with a pro or retro, he's designed it to get the tooth to finish at that 7 degrees on an anterior front tooth, central incisor, and get to that end position. So no longer do we have to go and use things such as torquing slings or flipping brackets upside down. That's the beauty of this system, the way that Dr. Damon has designed that, so that those pro and retro torques will get us to that end position. And if it doesn't, then we just increase a wire size to express more of that torque, instead of going and saying, oh, I'm going to have to flip one and lose your way. I did that for years. And this system is so much more simple, and it's more consistent in getting those end results without having to do that stuff.
Thank you. Maybe slightly connected to next one is, do you use reverse curve wires with the Damon Ultima system?
Great question. In one of my cases, I should have pointed it out. It slipped me, but one of those cases I showed you, I think it was the first one, I used reverse curve wire with Ultima. So there are certain times where I feel like I'm just a little bit deep, and I have used a 1725. We don't have a reverse curve Ultima wire yet. That's my wish list, but we will use a 1725 reverse curve on the lower with Ultima, and we have good success with that.
Okay, thank you so much. So I think we're getting towards the end of the questions here. Let's see. Sorry, I have two screens looking at the questions here. Just a second. So about standard torque brackets, because they have been around forever. Am I getting this right? The question is, am I getting it right that you don't use standard torque brackets at all? So there's no reason to buy it. That's a straightforward question. Yeah.
Very straightforward. Hey, let's talk a little bit more about this. The standard torque bracket with the Ultima wires will give you 99% rotation control and in and out control. But when you have, it will not give you it will not give you torque control or angulation control. So and I asked Dr. Damon, why did you create it then? And he said there are some people that still want to use it, even though it doesn't have torque control or angulation control. It didn't make sense to me because every Ultima case that I finished with neutral torque, I had to bend the wire to get that tooth to the end position. So he made it because that's what we've always had, but we found by sad experience that when we did cases, when we treated the Ultima like we did with Q2 and choosing a lot of neutral torque, I felt like I had a Q2 bracket on, not an Ultima bracket on. So if you want to experience the beauty of Ultima, choose Pro and Retro, don't buy neutral.
Perfect, thank you. And maybe also clarify here, why are we not using early class 2-3 elastics and rather wait for the 14275 copper night tie?
Okay, it's a great point. And we'll go back again to the setup of the 14275 wire. Remember what I said, when you put the 14275 wire in a case, you have point contact at the door. That's going to give you the most upright and widening of the arches at that 14275. If you place if you place a shorty class 2, you're going to limit the transverse arch development. I want you to think about this. This is really important. If you trust the Ultima system and what we're trying to accomplish, which means we're getting a wider transverse development, then why would you want to do anything from class 2 or class 3 to limit that natural uprighting and widening from this wire? So for me, I understand that the transverse arch development is key to finishing a lot of our cases. If we don't get the transverse, then we're struggling to get down the track and finish. So knowing that the transverse really gets developed when we first put that 14275 wire in, then I don't want anything to disturb that transverse arch development. So I wait till that 14275 has been in and expressed before I start the rubber bands.
Perfect, thank you. So let's see here. What protocol are you using for extraction cases, Bimax cases?
Yeah, so if we were to have a Bimax protrusion, extract upper and lower four bicuspids, first bicuspids, I would choose proclining torque, upper 3-3, proclining torque, lower 3-3. Think about this. This is the first time with passive self-ligation that we've had a proclining lower 2-2 bracket. How amazing is that? So now when you're retracting a lower arch, we're not worried about that lower incisor dumping anymore. And again, this would be in our full size 18275 wire. That's going to keep your lowers upright as you retract. And even your uppers aren't going to dump either because you have that 3D control as you're retracting your arches.
Thank you. I think we have 2 more questions here. Do you want upper and lower braces in the same session or start with only upper to gain space for lower bracket?
Great question. For me, for 99% of the time, I bond upper and lower the same day. There are some cases where if I have to open up space for a blocked out cuspid and the lower arch is beautiful, there's not much to do on the lower arch, I'll start on the upper until I get the space for the cuspid. And then when I bond the cuspid, I'll put the lowers on.
Okay, thank you. Another one here, interesting. How much more predictable is Ultima compared to Q2 because of the full expression? I like that question. It's interesting.
I love this question. Let me try to put it to you this way. In our practice, we see a lot of patients. In fact, we see over 150 patients a day. There's 2 doctors, and it's a very big clinic. And one thing that I'm experiencing now is that when I come to the chair, I can tell the difference between Ultima and Q2 without looking at the brackets. It's like this. it's like the angels are like singing and the sunlight's coming down on the case. I guess what I would say, how predictable, when you choose the Procliner Retro and you go through the wire sequencing, you're going to get what you choose. And for me, it's taken out a lot of worry. It's taken out a lot of, reactive, because I think Q2 is a reactive system. You would do one thing, you'd react. You do another, you react. With Ultima, it's choose it, and then you get to that spot and you're like, oh, wow, this is amazing. So it's very predictive. You get what you put into it. And if you follow the protocols with the wires, now we're not going to put somebody else's wires. We're not going to buy cheap wires, because nobody on this planet has made a round rectangular wire. That round rectangular wire, it's the motor, it's the engine that makes this happen. So you want to follow the recipe and use the wires that are round rectangular, use the Pro and Retro. And when you do that, it's going to be more predictive and get to that position than you've ever experienced. It's amazing.
Thank you so much for answering all the questions. We might have missed one or two since I'm working with two screens here. So, but again, if you haven't gotten your question answered, please reach out to your ORMC representative, and we will get them processed with a competent person. So I think that with those words, I would like to thank you so much again, Dr. Frost, for getting on this late night, for many of us, webinar, and looking forward to hear you soon again. And also I would like to encourage you all to sign up, if you haven't already, for the next webinars that we have coming up. I think, yes, we have it on the screen now. So if you haven't signed up for the session with Dr. Michael Bicknell on March 21, please do so. And with these words, and I would again like to thank you, Dr. Frost, and the whole team for putting this together. And I wish you all a good night. Thank you.